Good morning, everybody. Very quick message. Just seen a patient and really highlighted a very important point about spine health that is often overlooked when it comes to management of people with spine pain. So when I was talking to that patient, I just tried to really simplify it down for him in this manner, and it seemed to resonate pretty well, so I thought I'd make a quick video of it. So if I talk about the spine or the health of the spine in this way, it gets the message across pretty effectively. Spine health is really related to two things: the structure of the spine and the function of the spine. Structure and function of the spine. So the important concept here is that there is a strong link between structure and function that determines the health of the spine. For example, if we had a 75-year-old man who obviously on imaging of their spine, we would see some structural derangements or structural changes that we quite commonly refer to as degeneration. If we had those structural problems, or if we had those structural changes, but that 75-year-old man had maintained healthy functioning movement of the spine throughout his whole life, he may not have any spinal health issues at all. He might not have any spine pain at all. At the same token, if we had a very young 20-year-old worker who had absolutely pristine looking MRI scan with healthy looking discs and healthy facet joints and muscles, but that worker was engaging in physical tasks with very poor function, that worker could easily be experiencing significant compromise to his spine health and experiencing constant pain. So it really does depend on this relationship between structure and function that determines the health of our spine. So the case in point was a fellow who had spine pain and for a long time was receiving therapies, and I listed the therapies depending on whether they were therapies that focused in on structure. And let's think about the common therapies that are delivered to people with spine pain. So he had a lot of passive therapies, hot packs, massage. He had needling. He had the deep tissue release with hockey balls and those foam rollers and things like that. So deep tissue release. Whether that really classifies as deep tissue is another question. So deep tissue releases. He had time off work. Okay, just resting the spine. He had anti-inflammatories, so what we call non-steroidal anti-inflammatory drugs, and other medications. And of course, these are targeting receptors and information that is perceived to be within the structure of the spine. So anti-inflammatories are trying to switch off inflammation that may be associated with muscles, tendons, ligaments, joints, discs. He had facet injections, facet joint injections of cortisone, and cortisone is another anti-inflammatory. It's targeting the structure of the spine. And this fellow didn't have surgery, but some people will go on and have surgery on their spine. Again, it's another way of trying to obtain spine health through targeting structure. Okay, the passive, these are the rub downs. Okay. Getting on the couch with your physical therapist and immediately having that hands-on therapy. It's a structural approach to fixing the problem. And I said to him, look at all these therapies here. Everything has been targeted towards the joints, the muscles, tendons and ligaments of your spine region pain. How much, oh, I forgot one more thing, strengthening, okay, so core strengthening. And exercise. How much time have you applied to this? Okay. And he really didn't understand what I meant by fixing function. But when I explained to him that if the spine is not functioning properly, then regardless of structure, if the spine is not functioning properly, you will still experience spine pain. Okay? And if you continue to ignore the function of the spine, as time goes on, you will develop structural deterioration. And now you have two problems. You have a dysfunctional spine and you have structural problems. And that is going to compound in a negative way once you get problems with both. When function is not addressed, you then develop the structural deterioration, and both of these things are driving poor spine health. This patient had no structural problems in his spine, no structural problems at all, yet all of the therapies short of, on this list, short of surgery, had been directed towards structure. And so it made complete and logical sense that we, instead of continuing to throw darts at these remedies, you must also start to throw a few darts at improving function. Okay, and that's where we have to teach people on a neurological level how to move their spine in a functional, biomechanically correct manner every second of every day. That's a neurological fix. Okay, it's difficult. One thing from experience, we've been delivering it for a long time. It's difficult. It takes patients a long time to retrain their motor patterns in their brain, retrain the motor patterns which control the way the body moves. It's time consuming. And it's upskilling. Okay? So when we improve someone's spinal function, we are upskilling that person, and it doesn't matter whether they're a teenager or whether they're an 80-year-old, we are upskilling that person's brain, because that person's brain is in charge of the way the spine functions. Now, the moment that patient has that light bulb moment and they obtain that new skill, they have improved their function. And once we tick off the acquisition of healthy functional spine, and we already accept that there's very rarely significant structural problems if we get them in time, if we fix up if their structure is fine, now we can have this sort of thing happening in a positive way to obtaining lifelong definitive spine health. Okay, so I hope that makes sense for you. The very strong interrelationship between function and structure and spine health. And most importantly, if we get people functioning well, we can eliminate the progression of symptomatic structural changes to avoid chronic spine pain. Okay, thanks very much.